In January 2018, South Nassau's Board of Directors voted unanimously to join the Mount Sinai Health System in an effort to expand and improve the quality of care available for residents of the South Shore. Here's one patient's story about what the affiliation has meant for him.
When the doctors told me I had all the makings of a widowmaker, I was really blown away. I mean, I was feeling fine. I just didn't know what to make of it. I originally went to South Nassau Primary Care in Belmore for my annual physical. Dr. Carolyn McKyman decided that because I was an ex-smoker and I had this history of blockage in my carotid artery, that additional tests would be required.
We decided that a cardiac catheterization would be the best method of diagnosing coronary artery disease.
His blockages were very serious. He had disease in his left main, which is the most prominent vessel in the heart, and a heart attack in that area can be deadly.
I was really thrown for a loop, and really kind of depressed me that the fact that it's something he couldn't take care of right there and then, and I needed open heart surgery.
So it happened that on the same day as the catheterization, Dr. Varghese was seeing patients here at South Nassau.
We had offered to already set up an appointment for him to come into the city to meet our anesthesiologist and get the preoperative testing done.
I was very nervous, very anxious, as I guess is kind of normal when someone tells you you need heart surgery. He was so reassuring and calming, and I left that office just thinking to myself that this was going to be okay.
The surgery itself was about 3 hours long, and after surgery he went to our specialized cardiac surgery intensive care unit. The following morning he was already sitting in the chair, looking great, and he looked like he had surgery. He surprised us all. Spent another 3 to 4 days acting like the model patient, and he was discharged home doing great.
On Sunday, May 6th, I was back at church. 6 days earlier, I was lying on an operating table having heart surgery.
After we provided the specialized care at Mount Sinai, the follow-up was back here on the island at South Nassau Hospital, allowing him to see his local doctors.
Mr. Regan's prognosis is great. I mean, he's doing great post-operatively, and his heart function is completely normal. I hope my heart is as good as his.
When we first began our relationship with South Nassau Community's Hospital, early on we saw the importance of having localized care on the island when possible, and then moving on to specialized care in the city at Mount Sinai as needed. And so I think this team approach that we have is growing, and I see great things in the future.
The team of doctors at both South Nassau and Mount Sinai, they saved me. I'm so grateful to have so many more years with my beautiful wife and daughter. They gave me a new lease on life, and I'm taking full advantage of it.